Hi, this is Nathan with St. Mary's LifeFlight, and today we're going to be going over chest tube management in the transport environment. I know when you have to manage these chest tubes, it can be a little bit overwhelming just because of the rarity that you would get a hands-on approach with these. But if you break it down, the Atrium, like most models have in hospitals, it can be quite simple once you start looking at what you need to do to manage the chest tube. So basically the Atrium is 3 separate containers in one small box. So this channel is your collection device channel. This is where your blood and air is going to be coming through. This section with this white bubble is your water seal, and then you'll see over here is your suction containment area. So what you're going to be looking for when you first come in to look at the patient and the chest tube, you're going to be looking, make sure it may have some bubbles if there is a leak, and I'll show you that here in a second when I turn on suction. But what you're really looking for is maintaining suction, and this is including during the transport, even if it's a few minutes. You want to make sure you have suction so there's negative pressure coming out of the patient. So I'm going to turn that on, and what you're going to be looking for is this orange plunger is going to be coming over into this arrow that you're going to have ideal suction, and you're wanting 20 millimeters of suction on this. So I'm going to turn this on, and you'll be able to see that plunger come out. And you'll notice that there are bubbles, and if I would clamp this off to show that, to help to find if there's a leak, you'll notice that went down. So that's a little review on the suction, and this is a helpful way to check for a leak within the chest tube. So what you would do is you could, this area is going to be connecting the chest tube from the patient, so you could simply clamp that off to see if your leak is away from the patient and is part of the container, so they might need to change that if there is a major leak. A few helpful tips of managing a chest tube in the transport environment is always make sure this is unclamped. You always want to do a systematic approach when you first get to the patient. Check the patient chest tube area, how it was inserted. If you can see any drainage, make sure you note that, so during the transport you can notice if there's any more. Make sure you don't really want to tug on it because they are sutured and taped in, but you don't want to worry about dislodging that. And this will insert in the chest tube. There's going to be a lot of tape around that. You could check to see, make sure there's no leaks there. This tube is for blood collection. This is if the containment area would be too full, you could simply drain that. This port is where your suction comes in. And then this port is if there's a clot coming out of the chest tube. You don't want to clamp and pull a lot of tension. You would do a hands over hands approach to dislodge the clot. And then if you can get the clot down here, you can simply take a plunger and evacuate the clot if possible, or if you can get it to go in the collection device. So a few more helpful tips are always make sure the Atrium is below the patient's chest wall to help with pressure. And always make sure when you are transferring the patient, make sure if you have extra hands, you can have someone exclusively hold this so it doesn't get dislodged, hanging off the side of the cot. And then once you get back in the ambulance, make sure you turn suction on to keep the chest tube draining. I hope this was very helpful, and thank you very much.